Hey guys, thank you so much for joining me on WellnessKE. My name is Fatma. Today we're going to talk about a very sensitive topic, which is miscarriage. We're going to understand what causes a miscarriage, the types of miscarriages, and also we're going to understand a very important hormone that could potentially play a role in preventing a miscarriage. So keep watching. So if you've clicked on this video, you'd like to learn more about miscarriages. But before we get into the conversation, I'd like to remind you that you can actually click the like button on this video to ensure that YouTube gets to share this video with more women so they can learn more about this particular topic. Also, remember to subscribe and hit that notification bell. That way you know every time we post a new video. And as always, don't forget to share and to recommend us to friends and family. So let's get into the conversation. A miscarriage. Now, a miscarriage is something that actually happens that is quite traumatic and sad and affects many women out there. But today we want to understand, in the world of medicine, what do they consider a miscarriage? And we'd like to understand what are some of the causes, the risk factors, and also if there are ways that you can be able to prevent, per se, a miscarriage. Then we'd like to learn more about them. So a miscarriage is actually known as a spontaneous loss of a baby. And in the medical terms, they actually call a miscarriage a spontaneous abortion. So a spontaneous abortion meaning a woman has actually lost a fetus or the baby during pregnancy. It could actually happen in the first trimester, second trimester, or third, whichever. But a woman that suffers a miscarriage knows that she gets to suffer a very, very traumatic experience. So basically, I'd like for you to understand that a miscarriage actually is one of the most common pregnancy related conditions or experiences, and it affects many women. And it's also really important for us to understand the numbers. So women who actually undergo one miscarriage actually have a 14% chance of undergoing another miscarriage. Women who experience two miscarriages have a 26% chance of experiencing another miscarriage. And also, women who experience more than three miscarriages, they actually have a 28% chance of experiencing another miscarriage. So you can see a trend that when a woman has actually undergone one miscarriage, the chances of her undergoing another and another are actually quite higher. But this is not to scare you. There is a number that I really want for you to know so that you can actually have a more positive outlook towards this entire situation. And that number is 90. Because women who have undergone a miscarriage actually stand a 90% chance of actually having a healthy and full-term pregnancy. There's like a 90%, there's 90% of women who have actually still either undergone a miscarriage and then went on to have a healthy full-term pregnancy. So as a woman, you should not be scared. This information is actually for you to learn more so that you can be able to communicate with your doctor. Every time you go for a visit, you actually know what to look out for, what to ask, what to relay, so that your doctor can be able to help you so that you can have a healthy full-term pregnancy. So something I really want for us to understand is the types of miscarriages, because there are several types of miscarriages, but then I want for us to know the most common so that when you as a woman you get to hear this information, you'll actually know. If you have undergone a miscarriage, you'll know the type, and if you haven't or someone you know, then you can be able to educate them. So the first type of miscarriage is known as a missed miscarriage. And a missed miscarriage happens to be one of the most traumatic forms of miscarriage. Not that these other ones are not traumatic. Of course, they are equally traumatic. But a missed miscarriage actually happens when a woman actually has no signs or symptoms of a miscarriage, but the fetus or the baby has died. So this is one of the types of miscarriages. The second type of miscarriage is known as an incomplete miscarriage. An incomplete miscarriage means a woman has actually undergone a miscarriage, but there's still some tissue in the uterus of the woman. So this is something that she can be able to relay to the doctor so that they can find ways to remove the tissue that has remained in the uterus. Another type of miscarriage is known as a complete miscarriage, whereby a woman has undergone a miscarriage and all the fetal tissue has actually left the uterus of a woman. So this is what they call a complete miscarriage. There's also another form of miscarriage which is known as a septic miscarriage. A septic miscarriage is also quite a dangerous kind of miscarriage because it means that a woman actually has a uterine infection or an infection in her uterus and has caused a miscarriage. So it's important for a woman to actually relay this to the doctor, and sometimes it is the doctor who will find out that the uterus is septic or has an infection, and they're going to find ways to be able to help the mother. Another type of miscarriage is known as a threatened miscarriage. This means that a woman actually has a potential of having a miscarriage. And one of the most common signs or symptoms is vaginal bleeding. So it could be spotting, or it could be bleeding, it could be a gush of blood that is in clots. So a woman experiences this every time she goes, to the loo. And if this happens, then she can be able to relay this information quickly to her doctor so that they can try and do something to help her. Now, what they'll do is they'll carry out some tests to find out if there is a heartbeat or there is none. If they do find that there is a heartbeat or fetal heartbeat, then they will consider this or categorize this as a threatened miscarriage, meaning it has a potential of becoming a miscarriage. But if there is no heartbeat, then sadly that means they're going to classify it as a miscarriage. So it could either be a complete miscarriage, an incomplete miscarriage, whichever the case, they'll still classify it as a miscarriage. So now that we've understood the types of miscarriages that are out there, I'd like for us to understand what are some of the reasons that a woman might actually undergo a miscarriage. This part is really important. So a woman might actually undergo a miscarriage for several reasons, but I want for us to understand some of them, which are the most common. The first one is abnormal placental development. So you know about the placenta, and it's very, very important because it almost acts as a link or a channel between a mother and the womb, because any supply of nutrients or blood flow actually needs to go through the placenta so that it can reach the baby. So the thing is that if a woman does not have a properly developed placenta, then that means if, for instance, there was supposed to be blood flow that's supposed to get to the fetus, then if there is improper development of the placenta, then that means the fetus is not going to get the proper blood flow. And in that case, the fetus can die. And obviously that means it's going to lead to a miscarriage. So this is important. Your doctor might actually need to carry out some tests and find out if there are any symptoms to show that there's issues with placental development. Another reason could be chromosome issues, and chromosomal issues actually affect the fetus or the baby. So it could be that there are some abnormalities in the baby or in the fetus, and in the medical terms they like to believe that sometimes nature has its own way of showing that maybe this particular pregnancy was actually going to have complications, or the baby actually might have some malfunctioning or some abnormalities rather. So it's nature's way of just almost getting rid of this particular pregnancy because it already had some abnormalities. And I know this is quite a controversial statement, but in medical terms, this is actually something that they believe, that sometimes nature actually is trying to get rid of something if already it sensed that it was going to have some type of abnormalities. So chromosomal issues actually affect the fetus. Another reason that a woman could actually have a miscarriage could be health complications. Health complications or chronic illnesses. For instance, if a woman has high blood pressure, she has diabetes, she has HIV, lupus, autoimmune diseases, or even thyroid related diseases like hypothyroidism or hyperthyroidism, these could actually cause miscarriage. Also, some STDs like gonorrhea and syphilis could actually cause a miscarriage. There are also some conditions like thrombotic disorders where a woman may be her blood actually is always going through thrombosis or clotting, meaning this particular blood from the mother is supposed to go to the fetus. So if it clots all the time, that means the baby is not going to be able to survive, and this could be one of the conditions that causes a miscarriage. So it's important for a woman, if she has any type of medical complications or conditions, she needs to relay this to her doctor so that they can find ways to mitigate or to help her throughout her pregnancy. And speaking of conditions, it could be that you're taking certain medications. There are some types of medications that could actually cause a miscarriage. So if you are on any kind of medications, please make sure that you talk to your doctor about this. Let them know whatever type of medication you are on, because some types of medications have been reported to, cause a miscarriage. Another reason that a woman could actually have a miscarriage could be uterine conditions. For instance, fibroids is one of them, because let's take an example of a fibroid that has developed in an area or the location where the fetus could have developed or grown. So that means this is actually going to be a disruption. So that could cause a miscarriage. Another one could be polyps that have developed, or some type of conditions like PCOD, polycystic ovarian disease, could actually cause a miscarriage. Doesn't necessarily mean that women who have this are going to have, but this is something that doctors actually look out for, just as a precautionary tale, so that they can know what to do to help you out in the process. Infections could actually be one of the reasons that a woman can actually have a miscarriage. Any kind of infection. So it's important for a woman to boost her immunity so that she can avoid any types of infections, and make sure that she can have a healthy full-term pregnancy. Also, if a woman has a uterus that is shaped in an abnormal way, that could actually be one of the reasons that a woman might suffer a miscarriage. Another one that's also very important for us to know is a weakened cervix. So if a woman has a weakened cervix, she might actually undergo a miscarriage. And it's important for us to know what might cause a weakened cervix. Sometimes it could be a uterine abnormality. Sometimes it could be genetically a woman actually has a weakened cervix. Maybe she has a certain condition that leads to, some type of abnormalities whereby maybe enough protein was supposed to be produced to form tissues that could lead to a stronger, healthy cervix. But if that doesn't happen and this woman suffers this condition, she might actually have a weakened cervix. Also, something else that's important for us to remember that causes a weakened cervix: women who are exposed to a certain synthetic type of estrogen, which is a hormone estrogen, but then in its synthetic form, that is known as DES. Women who are exposed to this synthetic type of estrogen before birth might actually suffer miscarriage during their pregnancy. So it's really important for you to also tell your doctor if you're taking any kind of hormonal type of pill, or any kind of hormones or hormone therapy. Relay all this type of information to your doctor for them to know what might work and what might not work for you. And as I mentioned, there are many reasons women might suffer a miscarriage, but these are some of the ones that are very important for us to know about and for you as a woman to look out for if you're planning to start a pregnancy. So another reason that a woman could actually undergo a miscarriage could be poor diet or malnutrition. Remember, it is the mother who is supposed to be supplying enough nutrients and vitamins and minerals through her blood so that it can be able to help in a healthy baby or fetal development. So if you're not eating enough fruit, vegetables, nuts and seeds, good quality protein, carbohydrates, all these foods that are actually needed, hydrating enough, these are some of the reasons that a woman might actually undergo a miscarriage. So it's important for you to actually look into changing your diet prior to starting your pregnancy journey, during your pregnancy journey, and also after your pregnancy journey. And lastly, another reason a woman can actually undergo a miscarriage is food poisoning. So this is why you find that some people actually try and avoid foods that might actually cause food poisoning. It's very important for you to know where you source your food, how you prepare it, how clean it is, and things like that. And even when eating out at restaurants and local places that you eat out, it's very important for you to be very cautious, because food poisoning could actually be a risk factor or a reason a woman might undergo a miscarriage. So, what are some of the signs and symptoms of a miscarriage? Before we discuss this, it's important for you to know that this could vary in women and also depending on where your pregnancy is at. It could be the first trimester, second trimester, so that part is also really important for you to know as a woman. But here are some of the most common. Vaginal bleeding is one. As I mentioned, it could be a gush of blood, it could be clotting, it could be spotting that's happening. It could also be through pelvic pain. Some women experience abdominal cramping. Some women actually experience sudden weight loss because that is one of the signs that a woman has actually undergone a miscarriage. Something else that could prove that a woman is actually going through a miscarriage could be vaginal discharge in form of, it's like a mucus form of vaginal discharge. This could be one of the signs and symptoms of a miscarriage. Also, sadly, the loss of pregnancy symptoms. For instance, if a woman normally used to have morning sickness or breast tenderness and things like that, if these disappear, then this could be one of the reasons or one of the signs to show that maybe this woman has actually undergone a miscarriage. Something else could also be lower back pain. So lower back pain could actually be an indication of a miscarriage. And lastly, some women experience uterine contraction. So the uterus actually contracting could actually be a sign that a woman has undergone a miscarriage. So now I want for you to understand, if you suspect that you've undergone a miscarriage, you've gone to the hospital, what are the things that you're going to expect your doctor is going to do? So your doctor is going to try and do three things. Number one, he'll actually check your blood. So he'll do a blood test because he's going to check for certain hormones, because when a woman is pregnant, she actually has certain hormones and they can tell in a blood test, through a blood test. But if you, for instance, have suffered a miscarriage and they draw your blood, then they're going to discover that your hormones are actually quite different from a pregnant woman. Then they'll know that you've actually undergone a miscarriage. Another thing is they'll actually do a transvaginal ultrasound, and this ultrasound is actually going to help them in finding out if there is a fetal heartbeat. So if the fetus has a heartbeat, if the fetus has a heartbeat, as I mentioned before, then the doctor is going to say that this is a threatened miscarriage, meaning it has the potential of becoming a miscarriage. But then if there is no heartbeat, then they'll classify it as a miscarriage. Something else your doctor is going to do is a pelvic exam, and a pelvic exam is actually going to help them in finding out whether your endometrial lining is thick enough. And if it is thin, then they'll understand that you've actually undergone a miscarriage. And this probably happens in the first stages of pregnancy. So now I would like for us to talk about some of the risk factors that might actually make a woman more susceptible to going through a miscarriage. This part is really, really important.